Good afternoon and welcome to this edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11 and WCTV Channel 21. We are not streaming today because this program is being recorded actually the Monday before Thanksgiving, so 3 days or so after we did our last show, which should make it interesting to figure out what it is we're going to talk about, what's actually changed. But the doctors are here, Dr. David Jetmore, Wayne County Health Department, Dr. Thomas Huth, Reed Health, and also on the phone doing a Zoom thing with us this week, Christine Stinson, Executive Director of the Wayne County Health Department. I know it's only been a weekend, but when we were here last, we were looking at numbers from last week. I think the number that you had up on your slide was about 360, and you said, oh, we're probably going to blow by that. And I went, all right, we're looking at 450. I think we're above 500 for that number. That's a large number of cases in a week.
That's huge.
Yes, and when you reflect back on the numbers that we saw last spring or even this summer, they're incredibly huge. And the death toll continues to rise. We've had 5 deaths here in Wayne County over the weekend, another grim statistic.
We are, this is airing on the other side of Thanksgiving. Everybody has said, you know, try to avoid large gatherings was the information that you all were putting out. But as even this past weekend, looking at a lot of the national news organizations, air travel has been up. They were saying that some of the airports in the country haven't done this well since just before the pandemic or right at the beginning of the pandemic. People were out there. Some were wearing masks, but you kind of gather in an airport, you still have to go through the check, you still end up with people, you still end up in lines. And a lot of people were saying, I'm not gonna let it stop what I need to do.
It's interesting. If you talk about air travel on a plane, just being on the plane, it's fairly safe. The airplane itself replenishes half the air. The other half has gone through HEPA filters. The air comes down from above and goes out the sides on the floor. The problem with air travel is you gather at the airport for your ticket, you get in line for the plane, you get in line coming off the plane, you gather at the baggage carousel, you gather waiting for a taxi or somebody to pick you up. So it's a group of gatherings, and this, of course, is what causes the spread of COVID.
Let's bring in, if we can, I know we haven't asked any questions yet, but she's traveling today, so the surroundings may look a little strange. Christine Stinson with the Wayne County Health Department. How are you?
I'm well. Thank you guys for having me on today. I am traveling. You guys can guess where I'm at. You'll never guess, but anyway.
You're going to spin it around so we can see the parking lot or something that you're in?
In a beautiful park in Marshall County. I'm at their park downtown.
Okay.
On the way to South Bend.
Talk about what your office and what you've been seeing these last couple of weeks, Christine. We haven't had a chance to talk to you. Obviously, you're probably in and out of the testing site a fair amount. Talk about what you're seeing as far as numbers, what you're getting from people, what you're just hearing out there.
Well, our testing site remains incredibly busy, and thankfully we have the help of the National Guard in there, or we would not be able to have our testing levels at the level that they're at. We're testing well over 300 a day at just our testing site. The OptumServe site continues in Cambridge City, and they're consistently doing between 70 and 100 tests a day. So we certainly appreciate Cambridge City, the OptumServe site, and hope people utilize that testing site. Over the past few weeks, we've definitely seen a change in why people are getting tested, from I'm curious, I've been around someone, to people coming in because they have symptoms. So we're definitely seeing a lot more symptomatic people, and our positivity rate shows that. We're on our testing site only, I'm talking about our positivity rate that we see there ranges between 13 and 20% on when we're doing that. Right now, Wayne County, we're at 10% positivity. That's an increase again from 2 weeks ago, from last week. We're heading in the wrong direction. We would like to see it trending down, but we're not seeing that. And unfortunately, when we talk about the positivity rate, it's not just because the positivity rate, is because the positivity rate has an effect on our death rate, has an effect on our hospitalizations. And our hospitals and our healthcare systems are feeling the strain. Our long-term care facilities are feeling the strain. We've got to turn these numbers around. And I'm afraid that Thanksgiving is not going to help us. People have not heard our warnings. I've seen the same news channels that everyone else has, the packed airports and things like that. People are traveling and gathering for Thanksgiving. And I think that we're going to be really suffering from that, and increased deaths and increased hospitalizations and increased people with long-term effects of COVID-19.
In turn, kind of the three of you all, talk about the last couple of weeks, what it has done to your facilities, to your staffs, to their frame of mind to a certain extent, and where you kind of see this, because you all watch trends. We talk, you all watch trends. We're 5 weeks before the end of the year. Talk a little bit about kind of what you're hoping, what you're hoping doesn't happen, but what you think honestly, based on what we're seeing right now, will happen, and how that will affect your operation. There's a level here, and Dr. Jetmore, I've heard you say it a great deal. We don't want the schools to close. We don't want to shut down things. We want the kids to have sports. We want people to get out. You all have been where some people have said the government just wants to lock down and shut down everything. That has not been what you all have talked about. But you all are also saying there's a personal responsibility here. And if we don't kind of get a hold on that, what's the reaction? How do you all handle that? What is the magic point at which you all have to say, for as much as we don't want to do this, we don't have another choice?
You know, Eric, I don't think there's a number or a percentage or number of cases per day where you say, okay, when we reach that number, we've all got to go in the house and shut the door. You're right. I think keeping our businesses and keeping society open and controlling COVID kind of go hand in hand. And the public kind of is in charge of this. If they follow these suggestions or mandates, if you will, and wear masks and socially distance, we can have all of this. We can have businesses being open. But we've got to modify our behavior. We're getting, if we do get to the point where our positivity rate is so high and we're having so many infected people, and Dr. Huth can speak to this better than I can, our hospitals and ICUs just getting overwhelmed. And it's not just a matter of manufacturing beds. We need the personnel, and we need personnel that are able to put in long hours and not be totally psychologically and physically worn down by dealing with these infections over and over and over on a day-to-day basis. Then we'll have to lock things down. It'll just simply be imperative.
We hear it.
Dr. Jetmore has, articulated all that perfectly. It's hard to add to that. I would say the county has had a huge number of cases last week, way highest ever. We hope that will go down, but realistically, we've got these holidays where a lot of people are getting together, come heck or high water, and then shortly to be followed by Christmas, kind of the same thing. I mean, we're handling it at the hospital. I've talked over and over about how we have high number of admissions at any one moment, only a small number of beds, the constant sort of churn and so forth, and the toll that takes on staff to manage all that. we're going to see some burnout as a result of all that. We're seeing a little bits of it now. Now, there is a lot of community outpouring. We had a community prayer vigil at the hospital in the last 10 days or so. There's been some groups of school children who've chalked messages on sidewalks recently, and those things are uplifting and really give a lot of hope and encouragement to the folks who are dealing with it. And there is a lot of camaraderie and consolidation around the mission, that is to take care of these people in distress, that's prevalent right now. So those are all positive things, and we're handling that. But there are lags built into this whole process. So you just had a huge week in the county. We tend to see the impact of that on the hospital about a week later, because it takes the risk for hospitalization and more severe consequences tend to come about in the second week of illness, of symptomatic illness. So really next week will probably be a very big week for the hospital, even bigger than we've had so far. And question is, how do you get ready for that? I think to me, we can talk all day, hey, y'all out there in the community, start taking precautions, be more diligent, and we need to continually send that message. But at a certain point, if you're in a war, you stop wishing and encouraging the diplomats to make peace and not war, and you just say that we're in a war, we got to get ready and deal with this war as it is and not worry about the rest of it. And that's kind of where we are. We're just trying to figure out what we need to do to manage. We've created a number of overflow beds in some areas that aren't used to taking care of acute care patients, so that we can flow over some low acuity non-COVID patients and make room in the more acute care settings for the COVID patients. And that's working. We don't have those areas filled up, at least not yet. The real problem is, how do you staff that? I can create all kinds of beds, but we still have good levels of PPE, and we've got plenty of ventilators should we need them. But we got to have the staff, and that's where we're really running into the bottleneck now, because a lot of people are working a lot of hours, and I always go back to, we're talking about real people who are sick and dying. We had 3 deaths over this past weekend at Reed, and 4 deaths at Reed, and 3 of them were Wayne County residents. So that's several of your deaths in Wayne County, and that's all very stressful on people, and it's hard to see where this goes. But I'm not very encouraged by the fact that we're now going into the 2 major holidays of the year that people, we just know that people are going to get together regardless. I just hope that they're taking the precautions, or have taken at the time we see this show broadcast. Thanksgiving will be just slightly in the rearview mirror.
We'll still be in a turkey hangover.
But there'll still be some turkey in the house ready for the seconds and leftovers and the like. But then we'll be looking towards Christmas, and how do we deal with that? I'm not sure. Now, there is one bright spot. I have a metric that I've been looking at that gives me a sense of how worried is the community about what's going on, and that is how much toilet paper supply there is in the grocery store. And we shopped yesterday, and at least where we shopped, there was very little toilet paper. So that says to me that somebody's paying attention and starting to get worried about the levels again, which maybe is a good thing. We're worried about the toilet paper and the sanitizer and the cleaning products kind of being out and how we're going to get that. But actually, it's an indicator that a lot of people are engaged, and maybe that's what we need right now.
Christine, is your method of looking at this as scientific as the doctor's is? And talk about your staff. You haven't been in this job a year. I know it probably seems like 10 at this point. Met new people, moved into an area. This has been what you've had to deal with. You've moved buildings. So it's been a lot. Normally, your push in the health department right now would be about flu shots.
You're right.
And
yeah.
you all are trying to balance those two things. So talk about maybe what some of your staff is having to step back from to deal with this.
Yeah. Well, and Dr. Huth, he's such a glass half full, seeing the shelves half full of toilet paper and people heeding the warnings. I see it as, they're getting ready for all the guests coming to their house for Thanksgiving. So I'm definitely, we're exhausted, healthcare providers and public health professionals. We've been at full throttle since March. And anytime, you're working at that level for this amount of time, it's difficult. Mentally and physically, it's very taxing on my staff, on me personally, not just, because I'm new to the area and the personal things that have happened in my life with coming to Wayne County. It's just so hard, it's an unparalleled pandemic. But my staff is tremendous. I can't tell you how grateful I am for the staff that we have and everything that they put forth. And every ask I get a yes. And what else can I do? So we are there for the community, constantly trying to do better, constantly trying to improve services. The move from the health department, that split between the wellness center and the health department, was taxing on the community. And in the best of times, it's difficult. And so now we're in the worst of times, and we're trying to meet the needs. We've had several drive-through flu clinics, looking to have at least maybe one more, maybe geared toward 65 and older folks, to make sure. It's so important that they get that. We have the high-dose flu. You can come to the health department at the Elder Beerman site and do walk-in flus anytime between 9 and 3. But we will try to do another, because we've heard the community wanting another drive-through flu clinic. So we will attempt to have at least one more of those before the end of probably before Christmas. We'll have another one. But I would like to see people get their flu shot way before that. If you haven't gotten your flu shot yet, please get a flu shot. Doesn't have to be at the health department. There are lots of partners out there. CVS, Walmart, anywhere that's giving a flu shot. We all have the same flu vaccine. Get a flu shot. It's imperative. Not only because you individually don't want to combat both COVID and the flu at the same time, and we know they both can happen at the same time, but anything that we can do to alleviate stress on our healthcare systems, we all need to do our part right now. And that means isolating when you're sick. If you have symptoms of COVID-19, even if you don't have a test result, isolate away. We need to stop and get the trajectory of numbers going down and not back up again as we're seeing it. We will stay orange this week for Wayne County. I will announce that. Even though our positivity rate is at 10, remember, it's 14 that will trigger us into the red. But we're dancing really close to that. But we'll stay orange this week. I would love to stay orange all the way through Christmas, but it takes all of us doing our part.
Okay. Christine, I know you're on the road. I'm going to ask the doctors whether either one of them have something that they want to ask you about or point toward before we let you continue on your travels.
Not me. Christine's a tough act to follow. I think she said it all.
Okay.
I didn't say everything. I would like to say that I am very, very thankful to be here. I'm thankful for Dr. Jetmore being my health officer and the health officer of this community. I'm thankful for Dr. Huth. He has been tremendous for me and for this community. This region, actually. I don't know that everyone understands what a tremendous asset Dr. Huth has been, not only to Wayne County, but to a lot of other counties as he leads the healthcare industry through this. And then you, Eric, I'm so grateful for you. I wish I could have said it on a taping before Thanksgiving, but as I sit around my Thanksgiving table, I'm thankful for the three of you.
Thank you, Christine. We appreciate everything that you've done. You've hit the ground literally running here in Wayne County. So thank you. And
Thank you.
we'll have you back in the studio again soon. Safe travels.
Okay, thank you.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21. This one is not streaming on Facebook Live, as this is a recorded program, but we did ask you last week to provide us with some questions if you had some for the doctors, and lo and behold, we do have some questions for you gentlemen from the community. So as soon as they're able to fix that up in the director's area there, they will get the first one up faster than I thought they would. If you have tested positive for COVID and quarantined for 14 days, shouldn't you stay quarantined until you get a negative test? There are people testing positive and think that after 14 days they are fine and do not need to get tested again.
Well, actually, if you've tested positive for COVID, you only need to isolate for 10 days. The 14 days is for somebody that's a contact. But it's really not necessary to get tested. If you've isolated for 10 days and your symptoms are going down, you haven't had a fever for 24 hours, then it's not necessary to get a negative test. And actually, if you got a test and it was positive, it wouldn't mean that you had COVID or you were spreading COVID, because these tests can stay positive for a long time after you've recovered completely from having a COVID infection. You have anything to add to that, Tom?
Yeah, that's right. The old-time standard PCR test, that test for the genetic material of the virus, we now know can be positive for a long time. So we really have stopped all recommendations about doing follow-up testing by PCR, because that can be misleading for the reasons Dr. Jetmore mentioned. It doesn't mean that you're continuing to be contagious. There is another version of the test, that's the antigen test, that does not test for genetic material. What it tests is for antigens of the spike protein or the nucleocapsid, the protein capsule that the genetic material is encapsulated in the virus. That one's different. If you are an actual COVID patient and you're positive on the antigen test, that does indicate that you're currently contagious, but that will not stay positive for a long time. However, we still don't recommend that you get retested, because there's not really a point. You just, from the date of first testing positive, assuming that there are no symptoms prior to that, you only need to isolate for 10 days. Now, someone who's a contact on that 10th day has to quarantine for 14 days. And that causes some confusion to people to understand that difference. But the reason is that from the last time of contact of somebody who's a known positive, it can take 14 days to turn positive yourself. So there really are two different conditions there. If you are the known positive, well, we know that the chances of being contagious after about 10 days is practically nothing. But if you are a contact, it can take 14 days to become positive. And so that's why the difference in those. But it's very confusing. Bottom line is, we don't recommend doing any follow-up testing. It's just the time periods works very well.
So you can have a positive test but not be spreading the virus.
You can have a positive PCR.
Okay.
And not be actively contagious. We don't know. You could be or you might not be. We don't know for sure. It just depends on how far into the event you are.
At the end of that, if you tested positive, you go through that 10 days. You could have a positive test at the end of that 10 days, but you all are fairly certain that you're
Well,
not spreading at that point.
Right.
Am I saying that correctly?
Very, very certain. I mean, the test, the PCR test is so sensitive that it's picking up little fragments of the viral DNA. So the test is positive, but it has no real clinical meaning. You don't have the disease, and most importantly, you're not spreading the disease.
Okay. We've got another question. After people have had the COVID vaccine, are they immune from getting the virus? Also, will they be able to go mask-free even though others won't have been vaccinated? This will be an interesting question because you all are
Yes.
are close, I think, to being some of the first ones to get the vaccine
Yes,
here in
we
Wayne
are.
County.
Dr. Jetmore and I intend to be the very first people vaccinated in Wayne County if we can swing it. And we'll do that very publicly on camera and everything else so that people can see that we're willing to put our money where our mouths are on this issue. But to the question of, obviously the whole point of getting the vaccine is to become immunized so that you can't or are less likely to get the virus. There are a couple caveats to that. One is, even though we think the effectiveness is very high, it's not 100%. So there could be a reason to continue to mask because we've maybe reduced your chances of being able to get it, maybe quite a lot, but we probably cannot make it zero. We don't know yet exactly what the level of immunity really means. And the other caveat is that the public health authorities, I'm thinking here of the State Department of Health or the CDC, to my knowledge, have not yet opined on whether people need to continue to mask. But I think from my standpoint, after I get vaccinated, I assume I will continue to mask and distance and everything else because you don't know whether I've had it. So just because I'm running around without a mask on, part of it is ensuring that other people can feel confident that when they're around me, they are maximally protected. Now, I could go around showing my vaccine card. We will each get a little card that says we've had the vaccine. But really, the prominent sign that we are taking other people's safety into account is that we're still doing all the normal precautions ourselves.
Yeah, well, one thing is you're not going to be immune until you've had the second vaccine.
Correct.
In studies, the efficacy rate is 95%. Now, how that will translate, will it continue to hold, remains to be seen, but for all intents and purposes, people who've had the vaccine will be immune from getting the virus. And I agree with Tom. If I'm in a store, Eric, and there's somebody in the checkout lane ahead of me that's not wearing a mask, that's very disconcerting to me. It makes me crazy. I don't want to cause that with other people, so I'm going to continue to wear a mask. But ultimately, the whole point of this is we're all going to not have to wear masks. We're all going to be vaccinated. We're all going to be immune to the virus, and none of us will have to wear a mask.
Okay. Wishful thinking on your part. We can't get everybody to take a flu shot. So
Well, that's a good point.
Do we believe that we're going to get everybody to get this shot? And based on what you're hearing about potential distribution, and look, through this entire pandemic, it has been what we think we know this week, maybe isn't so right a couple of weeks later. This has been a changing thing. But to roll this out, and I know everybody keeps saying AstraZeneca has one, Pfizer has one, Moderna has one, you're still trying to vaccinate basically the world because this is showing up in a lot of different countries. So they're going to have to generate a lot of vaccine in order to be able to do that. Mm-hmm. At what point do you see just here in the U.S., the state of Indiana being able to vaccinate all of its people based on how this is rolling out? Are we looking at April?
I think if everybody would commit to taking the vaccine, probably the soonest it could be done will be next spring to summer. for the reasons you mentioned, just the being able to roll out enough supplies to do that, and keeping in mind most of the vaccines, except for the Johnson & Johnson, will require 2 shots, 3 or 4 weeks apart, depending on exactly which product you get. And then it takes another several weeks to build the immune response. So, I mean, you know, and that would be the perfect world. You know, we're talking, you know, maybe next April, May, June, at the very earliest possible. And that's if everybody will take the vaccine that's offered it. But we know that not everybody's going to. People have told us they're not going to. I have personal friends who've said they're not doing it. And, you know, everybody's got to make their own decision on that. And that's the way healthcare works from an ethical justice standpoint. Everybody gets to make their own decisions on this. And we respect that. But, you know, not everybody's going to do it. The question is, you know, at what point will enough people be immunized that we can feel comfortable that there is this level of quote-unquote herd immunity through vaccination that does not require that 100% of people be vaccinated, but it just needs a really high proportion. At what point that will happen, I think, given what we understand now about people's concern about taking the vaccine, or people outright saying they won't, or despite all the media on this, there are people who haven't really even heard about it because there are people who don't pay attention. And with all of that mixed in, I think it's going to be a good while before we're to the point where the CDC feels that there's enough, you know, vaccination and herd immunity in the community at large that we can go back to business as normal with respect to precautions. So,
You know, I've heard a lot of numbers on where you get herd immunity. I mean, what percent of the population has to be vaccinated in order to have herd immunity? I've heard 60%, I've heard 70%, I've heard 80%. We don't have any vaccine for children that are under 14,
right.
because they were never included in the trials for these various vaccines. That will have to be done. We'll have to have clinical trials for very young people in order for them to get vaccinated. Luckily, they're in a group that has the least chance of serious disease or death. But I would encourage anybody that's listening or watching to get this vaccine. Before we went on the show, Eric, Ryan was asking me, well, how do you feel about being the first or second person to get this vaccine? I said, they've done 44,000 people in these clinical trials, so I'm not the first. I'm the 44,000th and second, if I follow Tom here. So people need to be reassured that these clinical trials are done incredibly meticulously with the oversight of the FDA, and no corners were cut here. This is a very, very safe vaccine, and I'm looking forward to being vaccinated.
Follow-up question, and again, it's somewhat speculation, but based on your history, what you've seen with other vaccines, at what point will we begin to understand how long this vaccine will last in someone's system? At some point, will we begin to see the data that says, okay, you're good for a year, you're good for 2 years, on average, because nothing is 100% in any direction. But how long does it normally take for you to see that when a new vaccine for something comes out?
Well, normally, I mean, you can't really know this until time's passed. I mean, you'd like to know the answer to that question right now, but initially we thought there really wouldn't be much lasting immunity to this, because when people would get the vaccine, their antibodies levels would fall so quickly. But now we're seeing SARS patients who have had the disease, some as long ago as 17 years ago, and they've still got immune response to the disease. So, you know, we'll wait a year, and people will, if we can test the immune system. If their immune system is still responding, then that says, yeah, it lasts for a year. I'm hopeful that this disease is so potent or this vaccine is so potent, and our immune response will be so long-lasting that it will give us immunity for years, like people that have had SARS. I'm talking a long time for someone that prefaces by saying, "I don't know." Imagine if
That's why I like having you on the show.
If I actually did know something, but I unless Tom has any.
Well, I mean, we'll
opinions to
certainly
that.
hope that will be the case, and there are things about this whole situation, particularly when it comes to the vaccines, that we'd hoped would be the case, and it's matching the hope. You know, the high effectiveness level, the speed with which the vaccines have been developed. You know, early on in the discussion about vaccines, there was a lot of skepticism that these things could be achieved, yet that they've been done. So hopefully the long-term effectiveness will be exactly what you've described, and that could be. But right now there's conflicting evidence about how long does immunity last. You know, there are some studies that show that as early as a couple or 3 months after a natural infection, the antibody levels begin to decline. On the other hand, there was a big study done in Iceland. Virtually all of the population of Iceland who had acquired COVID-19 to that point were studied. And when they looked at all the different types of antibodies, they could see that after 4 months of follow-up, there were still good levels of the longer-lasting antibodies in that population. I don't know that the people of Iceland are that different from you and me. So what's right? Is it long-lasting and we don't know how long yet because there hasn't been enough time, or does it trail off early? You know, I think those are things yet to be determined. But the other wild card in there is, you know, could this virus mutate enough that it becomes a genetically different virus down the road, and that will be another reason to require you know, revaccination at some point in the future. I think I've heard people say that they think maybe every year it'll be the flu shot and a COVID shot, or maybe they'll figure out how to put them all into one shot. And you know, that could be the future as well. But all of that is yet to be determined, and we'll have to have a sort of a best of show about a year from now or 2 years from now to say, here's what we thought might happen or we wondered might happen. How did that work out? And we'll revisit that at some point. But it's, you know, we hope one thing, the reality may be quite different.
We could probably do that from the start of this show to now and just kind of work through that. It's been a changing thing every week. So we appreciate you all continuing to be here with us on a week in, week out basis and update the community on what it is that you know, what you hope, what you're hearing. You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21. This is a pre-recorded program. By the time you're seeing this, hopefully you have enjoyed your Thanksgiving dinner, and there's some leftover turkey. And if you are looking to be COVID tested today, that is not possible by the time this show airs. The testing sites were only open between 8 and 1 today. They will reopen on Monday, and we'll give you those times coming up here in just a little bit. We're taking your questions. We took your questions for the doctors, and we've got a few more that we want to try to get to before we run out of time. How has the COVID-19 virus affected Reed Health financially? And will it have an impact on salaries of the employees and or physicians?
Yeah, you know, if you just simply look at the impact really from the spring when we, by virtue of the governor's mandate, we stopped all elective procedures and so forth, that has a negative financial impact on the organization that's still kind of reverberating and is north of $10 million. I'll just put it that way. I think now what on the other hand, a part of the CARES Act from Congress provided basically grant money to try to make up the difference, and that is what kind of kept things afloat. So we've never had problems making payroll. We don't anticipate that, and you know, no one's lost a job over at Reed, and There was a little bit of time in the spring where some people were kind of idled because they couldn't, because their business was affected by the necessary temporary closures of those activities. But they're all busy now, and so I think that is a risk that if the numbers at the hospital continue to grow, maybe the governor is going to institute another elective procedure closure mandate, in which case we'd be back in the situation that we had in the spring, and that will require more funding from the federal or state government to try to keep that afloat. And I think that's probably a big reason why the governments are, at all levels, are trying to keep things going now so we don't have to do that, because I don't think the government can just simply endlessly print money to cover all of this.
They could, but it probably wouldn't be a good thing.
No, I mean, I just don't know how that would work. It's, but it has had an impact. Fortunately, the grant has helped quite a bit. So, but I would say Reed's situation is there are plenty of hospitals just like Reed in the same situation, but there are lots of others that have still suffered, and there's an increase in closure rate of hospitals over this. Those that were more on the border financially have not weathered all of this very well, and if we get back into that same situation, there'll be a lot more hospital closures as a result. So many places have struggled a lot more than Reed. Fortunately, Reed has always been fiscally very sound, and we've been able to weather it with our firm, fundamental financial situation and the CARES Act grant funding sources. But the future is another roll of the dice that I don't know what's going to happen there. You can never make promises, but if it's possible to come through this, Reed certainly will, because we always have.
Okay. Next question. I happen to live with a frontline worker in the medical field. Every night I listen to frustrations they are having with the public not doing the simple things. What is administration telling the nursing staffs and frontline workers to keep morale and spirits positive? And Dr. Jetmore, you can talk about this from the health department standpoint also, because you all have your professionals that, and you mentioned, Christine mentioned, they're tired.
Well, there's been a certain esprit de corps among the people in the health department. I mean, we feel like we're doing something important, and working together like this, it gives you a feeling of camaraderie. We've had our National Guardsmen join us, and they always bring a fresh infusion of enthusiasm. We've not reached that level, I don't think, where the morale has been depressed or the enthusiasm has been shut down. We continue, it seems like, well, the public sees these numbers every week, to test more and more people at both at our testing site at Elder Beerman, but so far we're keeping up with things both physically and from a morale standpoint. We don't have any particular motto or slogan that infuses these workers. They've been with, most of them have been with the health department for years, and they feel a tie with the health department and with the work we do. So it's a good thing.
And I would say at Reed, because I think the question is kind of more directed toward things at Reed in terms of what is the administration doing. Mm-hmm. We're trying to show appreciation wherever we can, point out who's doing great work, where great things are happening, and try to lift those folks up. So recognition is one thing, pats on the back, but also we've instituted an enhanced pay for those who are volunteering to work extra hours in roles that may be unfamiliar with them. They are receiving extra, pay in addition to their normal pay rates, just to kind of recognize that they're going above and beyond. And that can include working in all kinds of ways, not just with the COVID patients, because there are all kinds of ways in which people are busy and having to do extra. So we want to make sure that nobody feels left out because of that. As an example, we're readying our vaccine site, our clinic, to go as soon as the state gives the go. We get our vaccine and the state gives the go-ahead. And virtually all those folks will be volunteering extra hours to do it. And we'll be providing enhanced pay over and above their time and a half if they've already reached 40 hours. And just, again, to kind of highlight that they're really performing a special, filling a special need in the organization. Same thing with our monoclonal antibody clinic that's operating now. The people who are doing that are volunteering extra hours to do it. And we want to make sure that they get recognized in special ways for that. And but that can extend to a lot of activities. But the third thing I would mention is just the support and outreach from the community. I mentioned the community prayer vigil that was held a couple weeks ago, and I'm sure there'll be more of those in the future, and school kids reaching out. They did the sidewalk chalking, and they're also sending letters and things. And all of that is really uplifting and giving people the energy and the positive attitude to stick with it, because they see that their efforts are recognized.
Both talked about staffing, and one of the things that I think generates some of the questions from the community are things that we see on the national level. You all have talked about staffing and having people, and one of the things that you hear on the national news are the shortage of nurses, that we haven't had nurses coming out. Both doctors, both work with. Talk a little bit about the profession as it stands right now. What do you all think is causing the shortages that we're seeing, not only in nurses, but also even sometimes in doctors, and getting them to go or come to a place like Richmond? Easy to go to a larger hospital, University of Chicago, Scripps, wherever it is you want to go. Talk about what that's like, not only here, but as you all talk to some of your colleagues in other places with hospitals around this size. And I assume when you mentioned hospitals closing, it's somewhat more of the rural hospitals.
True that. Aside from COVID-19, it's a challenge to get highly trained professionals to come and live in a small rural community in Indiana. Basically, these days, new doctors, nurse practitioners, PAs, even nursing staff coming out of training. There's a natural allure to bigger cities, more urban areas, particularly if they're on a coast. So we commonly find that young doctors, as an example, will take less money and a much higher cost of living to be in Chicago or in Raleigh-Durham or somewhere on or near a coast. And that's because people want that kind of lifestyle. So our challenge always has been to get people here to see, A, that we've got a great hospital and a great community, and that they can kind of see themselves living in it. And in particular, we're more successful at that with folks who are from Indiana or from the Midwest generally, maybe Ohio, maybe Illinois. And so we try to focus our recruitment efforts on that. But there is a shortage across the board of virtually all specialties in medicine and all nursing categories. And because there's such huge demand and there's turnover and a lot of folks who are aging out of the profession. And then now with COVID-19, what you see is some folks who have more seniority, more experience, but maybe they're in a position where they don't absolutely have to work. They've got maybe spouses who have good jobs, and some people will make the decision that, hey, until the dust settles from COVID-19, I'm going to check out of the profession. And so that's not something we've seen a lot of here at Reed, but that is a factor in other hospitals around the state and around the country. I've had questions about that from media sources because they're aware of this. We've not seen it, but too much, but it is an issue, and it can really aggravate the shortage problems. And so those who are left are really taking on even more heroic roles to try to fill in and keep things afloat despite the shortages. So we're really, really proud of these individuals. And to me, that makes for a great fundamental base for new people to come join. You know, you got this great team with really fantastic individuals, and that's if you're looking for a great team to be a part of, this is the place, and I think we have that at Reed. But it's a challenge to recruit, and it's just a continuous thing.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21. This is a pre-recorded program. Hope you had a great Thanksgiving and that you're enjoying your weekend. We've got about 7 minutes left. We're going to try to get to a couple more questions. We still have a couple. That I work in a local factory, and a coworker was confirmed positive. My employer brought in a sanitizing crew, but allowed all of us to continue working in the area while they were cleaning. Is that okay?
Well, a lot of this depends on, obviously, the coworker who was confirmed positive needs to isolate for 10 days. But then I don't know what the exact makeup is of this workplace. I mean, if you're a worker that's working with the coworker across the line from them, closer than 6 feet and for more than 15 minutes, then you're a contact and you need to quarantine for 14 days. So I guess the answer to the question depends on where these people specifically were in relation to the positive worker, on how that needs to be dealt with. If they were all properly spaced and there was no real contact, then probably it was okay to continue working. But I don't know the circumstances. Do you have any thoughts, Tom?
Yeah, I mean, I think it really comes down to individual assessment of their contact status, and employers should have policies on this about how to assess all of that. In addition to that, depending on the industry, if it's a critical infrastructure type of industry, then there are allowances made for people who are asymptomatic being able to continue to work as long as they can maintain distance from other people, and if they're a contact, and they can maybe continue to work under some circumstances depending on the industry. So there isn't really one answer to this. It's just that employers have to really coordinate with health department of folks to really make sure the right thing gets done.
I think we've got time to try to get one more in. I have seasonal allergies. If I feel sick at all, even if I think it's my allergies, should I stay home, or is it okay to go to the store? If I wear a mask, wash my hands, etc. People don't know. They have cold, they have a sneeze.
Well, if you think, I have seasonal allergies as well, and typically the symptoms, seasonal allergy shares some symptoms with COVID. Typically you don't have a fever, you don't have a loss of your sense of smell, you typically do not have a severe cough or shortness of breath, but you do have sneezing, stuffy nose, itchy, watery eyes, runny nasal drainage. I think if you're concerned about going to work, I think the simple way to deal with this is this allergies or is this COVID, is to have a COVID test. And that will answer the question. But I think if you have just basically the allergies of the symptoms of allergies that you've had for years, or seasonal allergies, then I think it's all right to wear a mask and go to work.
You look like you were going to say something.
No, I did want to throw in, Eric, about monoclonal antibody clinic, and we're running that now.
Okay.
This is intended for people who meet certain high-risk categories, but who are not yet hospitalized. It's going very well, and I want to get more information out there because we want to, we've done kind of maybe prototyping of it. We want to figure out how to expand its reach. In particular, we want to make sure to get to high-risk folks who are from some certain ethnic categories where we know the burden of COVID-19 disease is a little bit higher than others. I think in particular of the Latino community, the Black community, and so we're going to be reaching out to some partners in the community who have more contact with these kinds of folks to figure out how we can get them levered into the monoclonal antibody clinic. And that's the whole point there is to try to prevent hospitalizations, which by virtue of that means you're going to prevent people getting worse and winding up on a ventilator and potentially dying. And so I'm very excited about that clinic, and the folks who are working on that are really being very heroic about it. Very proud of them, and there'll be more information on that as we come along.
Just under 3 minutes, Dr. Jetmore, I'm going to give you the final word. It's Friday. People are out doing some shopping, hanging out. Tell them what they need to be thinking about as they enjoy this Thanksgiving weekend.
I hope everybody, I'm assuming people are watching this Friday, and even though this is pre-recorded, I hope everybody had a good Thanksgiving. I hope you shared it with a small number of people, hopefully just the members of your immediate household. But as we finish this major holiday, and I mentioned earlier it's my favorite holiday, and go toward Christmas, I mean, this is a traditional time to gather, Christmas time. I know it's an important part of my family, and I'm sure it is of yours, Eric, and yours, Tom. But help is on the way. We've got a vaccine on the horizon, and we just all need to stay well until this vaccine arrives. You know, you don't want to be the soldier that got shot on the day that the peace accord was signed. So don't let your guard down. Let's try to have, for this, we'll have a great Christmas next year, but for this Christmas coming up, let's try to limit it to our immediate household. And I told my grandchildren we'll have another Christmas in June. So that cheered them up a little bit because their grandpa is pretty generous when it comes to presents. But that's my message, Eric. Everyone stay safe and hang in there. We'll make it through this.
Dr. David Jetmore, Wayne County Health Department. Dr. Thomas Huth, Vice President, Medical Affairs, Reed Health. Gentlemen, once again, thank you. Hope you enjoy the rest of your Thanksgiving weekend. COVID testing picks up again on Monday in a couple of different places, 8 to 6 at the old Elder Bierman site, 601 East Main Street. There's some information there on how you can do some scheduling. They do take walk-ins, but they would like you to schedule. Also, 138 West Main Street in Cambridge City. That's Monday through Friday from 8 a.m. to 8 p.m. And there is one thing I want to mention. There is a blood drive, the American Red Cross, taking place at the Richmond Senior Community Center. That's going to be Thursday, December 10th from 9 a.m. to 2 p.m. If you can help out, I'm sure like a lot of, normally we need blood this time of year, and I'm sure it is very important right now. Thanks for watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. As always, I wish you well. Shop local.